Okay, I think we could get going. The meeting is being recorded. Just wanted to let you know that, and your participation is your consent to allow that recording to happen. So if that's not okay with you, then you could leave the meeting and you'll get the recording and listen to it on your own. But I think everyone's probably okay with that. So just wanted to get that out of the way. See, everybody's hopping in here. I had been saying hello to everyone. I'm trying to keep up with it. So if I miss you, don't be offended. So welcome. Thank you again for joining the quarterly meeting of the Long Island Health Collaborative, and happy spring to everyone. It's a pretty day out there, so that's good. It's warming up. Some of you have already started to introduce yourselves in the chat. So if anyone has not done that yet, please do that. And that's also the way that we take attendance and can record who is involved in this meeting and record that for prosperity. Let's see. So if you all could do that, and everybody here. I'm just going to say hello to everyone. I see a lot of people are jumping on. Hi, Ashta. Good to have you on.
Hi, Janine.
Kelly, good to have you on. Okay. So let's get going. Next week, the Community Health Needs Assessment, the work group that's been meeting for the past 6-7 months or so, for the Community Health Needs Assessment. They will be coming together on April 5th, virtually, and looking at all of the data that's been collected through the Community Health Assessment Survey, which is individual perceptions of health barriers, health needs, and also looking at some qualitative data that we have amassed through community-based organization surveys and community-based key informant, organization leader, key informant interviews. So with all of that and looking at some secondary data as well, and the Sparks data from 2016, 17, and 18, we will, via consensus, select the priorities that this region will collectively work on the next 3-year cycle of the prevention agenda. So I thought we would just take a couple of minutes now. I'm sure everyone is familiar with the New York State Prevention Agenda, but we would just take a quick peek at it since it will be driving most of what we're going to be doing in the next 3 years. Let's see if I can hyperlink to that. There we are. Okay, so, okay, thank you, Brooke. Brooke hyperlinked for me. It's a little small, but anyway, Prevention Agenda 2019 to 24, as I said, this is going to be, I think I got to put my glasses on for this one. Yeah, that's better. For the next 3 years. And again, as you are all aware, and I assume you all are aware, that there are 5 priority areas from which the regions throughout the state can choose. First being prevent chronic disease, second, healthy and safe environment, third, healthy women, infants, and children, fourth, promote well-being and prevent mental and substance use disorders, and then prevent communicable diseases. And the task is to collectively, via consensus, select 2 priorities. In the past, it's been chronic disease, that's always risen to the top, as well as mental health issues and substance misuse issues. And the priority selection is really driven by what the data show, both what the qualitative and the quantitative data show. Now, this doesn't mean that a county or a hospital cannot work on other priorities as well. Certainly, there's no restriction. Community-based organizations are key in this whole process because they are the partners who are out in the community delivering particular programs that might, surrounding chronic disease or substance misuse or whatever it might be, working closely with the counties and the hospitals. So they are key vital partners in this process. And that's why their input was so aggressively sought throughout the research phase of this process. So if you want to take a quick look at those, as I said, we will be looking at the results of all the data next Tuesday. I do have preliminary data at this point from the Community Health Assessment Survey, and for both counties, the biggest ongoing health concern for the community is cancer. So that's what rose to the top for all of the surveys that we collected throughout 2021. And the biggest ongoing health concerns for individuals, for themselves, in Suffolk it's cancer, and in Nassau County it's heart disease and stroke. So we'll go into those much more deeply at next Tuesday's meeting, and anyone here is welcome to attend that meeting as well. And we'll send the link out for that. It is a Zoom meeting. It is the 2022 CHNA work group, but the more the merrier. It will be the hospitals and the county health departments that will be weighing in on the results of the data and selecting via consensus the two top priorities that we will work on. I think let's just take a peek at the prevention agenda priorities and the focus areas. I don't know if you're going to be able to see this that well. We can make it a little bigger. As you can see, each priority area is broken down into a focus area. There are 4 focus areas for prevent chronic disease. And in the past, the collaborative and its partners have been focused on combating, or if that's the correct word, but addressing chronic diseases via nutrition programs and physical activity programs. And most of the partners have worked in that space. You'll see here that they broke those two into 2 focus areas now. That's a little different than it was in the previous 3-year cycle. And you can choose 2 focus areas, just 1 priority, but 2 focus areas, and still meet the requirement of the state as well. So that's always an option if the group wants to go that way. They've added tobacco prevention and preventative care and management as 2 specific focus areas. And then each one has a number of goals underneath. And then those goals, when you go more deeply into the prevention agenda and look at its dashboard, you can see objectives linked to those goals. We won't go there now because it gets a little confusing, but there's very specific objectives linked to each of those goals. And on the dashboard, it shows statewide what the statewide target is and how we are close to it or not close to it on any particular goal. And that's how we kind of gauge our success as we move along. In the second priority area, they've got, let's see, 1, 2, 3, 5 focus areas, right? Then that's promote a healthy and safe environment. First area deals with injuries, violence, occupational health. They've broken down air quality into its own focus area, the built and indoor environments, and promote health, water quality is its own focus area, and food and consumer products is now its own area. So there's lots of opportunity to design specific interventions and programs to address such a vast array of public health issues. Under promote healthy women, infants, and children, it's maternal and women's health. Of course, reducing maternal mortality and morbidity is a goal, and a very important goal. And it is something that the state and the country is wrestling with, why we have such a high maternal mortality and morbidity rate, particularly among communities of color. So that's something a lot of organizations are working on. Perinatal and infant health, child and adolescent health, and cross-cutting healthy women, infants, and children. The 4th, promote well-being and prevent mental and substance use disorders. they switched to, or they included, if I recall from conversation years ago when the committee at the state level was putting this together, they wanted to, they wanted to rephrase mental health with the word well-being, believing that that is what we are trying to help people achieve, well-being at whatever level of well-being is correct for them. And so that's why you see that word in there now, well-being. And then of course, we want to work on those specific mental health disorders and substance use disorders that are plaguing our society. And then vaccine, prevent communicable diseases. I was curious, I thought at this go around, having, well, we're still in the pandemic, but having everyone live through the pandemic and the worst of it in 2020, the spring of 2020 or so, I thought that that was going to be an area that would perhaps rise to the top as one of the priorities or a top need, and it didn't, which was a little surprising to me. But nonetheless, most hospitals, and I know the counties, are working in some space around vaccine prevention, vaccine promotion. And as you heard, the FDA and the CDC just gave approval for a booster for those, I think, 50 and plus, second booster. So that's ongoing. Anyway, you can see in there again, focus area, vaccine preventable diseases. HIV has its own focus area. STIs have their own focus area. I had seen data couple of years back about STIs creeping up. Not sure if that's still the case. I have a feeling it might be. Hep C has its own area, as does antibiotic resistance and healthcare associated infections. So it's a pretty robust agenda, lots to choose from, but really it's the results of the data that will drive the priority selection. And that'll be happening in earnest on next Tuesday at that work group meeting, which is at 1 p.m. And we'll include, when we send a follow-up and summary of this meeting, the link to that meeting, if anyone else wants to attend besides just the work group members, just to see the process and how it works. All right, let's move on. Is anybody have any questions about the prevention agenda or? Everybody's comfortable with it?
Janine, quick question.
Yes.
If you do not submit this, what are the ramifications?
If you do not submit this, being what, the community health needs assessment?
Right, exactly.
Well, there are no, as I've said before, at the state level, community health needs assessment police. They strongly urge counties and the hospitals to work together to conduct this assessment.
This used to be for district money though, which no longer exists, correct?
No, it wasn't that. They had their own separate community health needs assessment. There's no more district money. Right. No, the requirement or there's a requirement to produce this, but there's no monetary penalty or anything like that if it's not submitted. However, for hospitals at the federal level, you have to submit that community health needs comprehensive one every 3 years to meet your IRS not-for-profit status. And that, if that's not done, that does come with a fine.
So that's at the federal level, and that's for non-for-profit. So hospitals that are not non-for-profit,
right,
don't have any requirements to do this for the federal or state level.
Right, for-profits do not have to do that because they don't have tax exempt status.
Gotcha.
So there's a whopping fine though at the federal level of, I believe it's 50 grand. I'm pretty sure that's what I read. I don't know of any hospitals in the nation. There's probably some hospitals in the nation that got hit with the fine. I'm not sure. But besides doing this to meet a requirement, I think what it shows is your commitment to the community. It's a way to see what programs and interventions you have in place. Have they been successful? Have they really not been successful? It's a way to find out what your community is thinking. Sometimes you might be surprised to find out that there is an incident, there's a pocket in your community that is suffering disproportionately, maybe from mental health, or there are high suicide rates for some reason. And that might be something you want to address as a not-for-profit mission-based hospital in your upcoming programming and interventions. So for those reasons, it's very useful, and it's good to know your market, right? So it's good to know your market, and it's good to know what people are thinking. So we collected about a little over 1,100 responses last year, which is about 3 times the number we collected in 2020. And that's because in 2020, we know what happened in 2020. There was really not much programming going on, not many interventions. Everything switched to virtual at some point. So there wasn't the opportunity to engage the community about their needs and their concerns to the level that we had done previously. We did, we rely on a convenience sample, right? So that's what we're using. It's a convenience sample. It is the organizations, the hospitals, community-based organizations, the counties, all those groups that are part of the Long Island Health Collaborative. We rely on them sending out links to the survey or paper copies of the survey, and that paper copies you send back to us, and we manually enter them into the Survey Monkey. So in 2020, there wasn't much going on, but we did get some responses. Last year was much better. Still, we've seen many more than 1,100 in previous years. So we want to ramp that up again. We here at the Collaborative aggressively promote this on social media and any forum in which we can. So everyone doing their part, that's how we end up with getting the responses. Maybe at some point, if there's ever any money that comes from any agency at some point in time, we could design a much more robust way of collecting our data among a representative sample, either through random phone calling or however we might choose to do it, even mailing surveys randomly to select households in different communities. But that again, right, takes time and money. So maybe this second waiver, which is percolating right now, federal waiver, I don't know what it's going to end up being. If it even ends up being anything, maybe there's might be some opportunity in that regard down the road, but that probably wouldn't, we probably wouldn't know about that until next year. So we do the best we can using a convenient sample. We do have a data analyst who looks at all the surveys. We do some demographic analysis as well, so that's always great to have. I did give you the highlights, and if you want, I'll quickly run through them again. If you recall on the survey, maybe let's look at the survey itself. And it's right on our website in a variety of languages, just in case you want to take a look at it. Right, so the first is asking, what is the biggest ongoing health concern in the community? And by the way, the Community Health Needs Assessment 2022 work group went through this survey with a fine-tooth comb, right? So, and as of 2022 forward, made some tweaks here and there to it. So what we're looking at is the survey that was distributed before those tweaks were made. So Suffolk County, as I said, the biggest concern for that county among the respondents is cancer, and the same for Nassau County. So that's still very much on the people's minds, and that's for the community concern. But for the concerns for oneself, in Suffolk County, it's cancer again, and it's heart disease and stroke. And heart disease and stroke, we all know heart disease is the leading cause of death in the US. if we look at the third question, what prevents you and your family from getting medical treatment? In Suffolk County, the top answer was fear. And they just they're not ready to face or discuss the health problem. And that's a concern to them. And in Nassau County, very interestingly, they said no barriers. So that's interesting. You know, if I had time and money, I would want to investigate that answer further, but we don't have time and money to do that. The fourth question, what is most needed to improve the health of your community? And this is no surprise, both counties, people reported what they need for their community on mental health services. And I don't think that's any surprise when we look at what has happened as a result, well, even before the pandemic, but certainly the pandemic exacerbated the situation with the mental health needs in our communities. And then what screenings or action or information are needed in your community? Suffolk County, screenings for mental health and depression. Nassau County, blood pressure. And that kind of goes hand in hand with them saying for themselves that that their concern was heart disease and stroke. So that makes sense. And the last question we asked was, where do you and your family get most of your health information? And both counties say from their doctor or health professional, which is good. Better than, I think, the internet. However, the internet scored in the second spot in Nassau County, and family and friends scored in the second spot for Suffolk County. Internet third for Suffolk, and family and friends third for Nassau County. So it's interesting. So next week, once we meet with the work group, we will have the full survey, the summary results, and then the full survey results on our website, from which you can fiddle around with it. And it's in Power Pivot. You can make your own tables, and there's a Power Pivot how-to webinar recording that we have on our website as well, if you need a little assistance. We certainly would help you if you need some assistance. We ourselves always have to re-educate ourselves when we go in to do this, because it's not something we do every day when we manipulate the data, but that's there for anyone to use. So by next Tuesday afternoon, or maybe Tuesday morning, that will be there for probably Tuesday morning, because then we'll go and actually look at the results on the site when we're conducting the meeting. So that's what we were able to accomplish for this go around. We will have, as I said, also results from, we did key informant interviews with a handful of community-based organization leaders. And we were specifically asking about social determinants of health. We certainly were asking about prevention agenda priorities. And we got some really great, through those conversations, insight as to what some of the pressures are on clients and patients out there in the community. So that will be included in a qualitative analysis report. We'll have preliminary results of that next Tuesday as well. And then we also sent out, similar to the Community Health Assessment Survey, the CHAS, right, that goes to individuals. We also sent a mirrored survey, same questions pretty much, to community-based organization leaders, so that we would have both a quantitative and a qualitative analysis in hand from among the community-based organization leaders. And we'll have that next week as well. I thought I would take you to any questions. Let me stop for a minute and see if there are any questions. If I'm going too fast, slow me down. Questions.
Janine, I noticed that this assessment was updated October 2021. I didn't see any COVID questions on there.
Yes, we had a very lengthy discussion with the work group members about adding a specific COVID question. And the group, after much discussion, decided that that would be too leading to use the word COVID. If you, let's go back to the survey. If we look at, can you pull that survey up again, Brooke? If we look, there's a question where they can actually write that in, vaccine preventable diseases. And then we felt that, again, it would be too leading and people would see the word COVID and automatically check that off because it was so much in the news. So they can check vaccine preventable diseases and they could also write other COVID if they wanted to. No one wrote COVID. It was just was a choice that the group decided to make after lengthy discussion. And we do have very knowledgeable people on that work group, including epidemiologists, physicians, community health workers who've been out working with community members for many, many years. And so they had a very robust discussion. And that is why you don't see a specific question related to COVID. I thought that they were going to want a question related to COVID, but that was not what the group decided to do. Does that answer your question? Okay.
Yes, it does.
Okay. I mean, it makes sense. After I listened to what my esteemed colleagues had to say about it, who are much more well-versed in public health research techniques than I am and survey design, it absolutely made sense. And so I deferred to their expertise. Let's see. Okay. So that's the survey, right? So I talked about this is the way we get our responses is through a convenience sample, meaning if an organization is holding a health fair or a health screening, they might distribute paper copies. They might we have QR codes that they could distribute on a piece of paper or whatever it might be. We have SurveyMonkey link. So we're kind of beholden to that method at this point in time. And so I'm always saying that the data that we get out is only as good as the data that is input, meaning the more organizations can circulate the survey, whether it's even in if you send out a community newsletter and you pop in the link to the survey, any means that we can get individuals to respond, that's what we use. And to follow up on that, we here at the Collaborative put together a toolkit, right? So of different posts, and that's on our site, right, Brooks? Someplace on our site?
Yes, it's on our website under the data
Right.
collection tools.
So, and we can co-brand this with you too. If you say, I want to slap my logo on there, we're happy to do that. So we put together some sample posts, directions, how to do it, Facebook, Twitter, LinkedIn. Do we have any actual posts with yeah, there they are. And we can co-brand that. We've been doing this and have had decent response. We did even put some money into boosting ads in particular zip codes. Was lukewarm effective, I would say, but we did put some money into that. So that's all there. And just if you email us today and say, look, I want to use a couple of the posts, but I want my logo on there, we'll co-brand it and we'll send it back to you, the whole package back, and you just have to then pop it into your rotation of social media posting or stick something like that in a newsletter or use the QR code, stick it in the newsletter, or whatever it is. We often go, if we hold like a walk with a doc, we'll take that along with us as well as other surveys that we collect, and we make that available. And some people, we talk about it, some people are willing to take it, particularly if they just need to take the phone, use their phone to do it, they can do it right then and there.
Oh, I'm sorry.
That's okay. So we got quite a number of ways that we try to get this survey circulated. With limited funds, well, really with no funds, basically, is how it's done pretty much at this point. So we're moving along, and we've been doing this since 2013. So there's trending data. If you look on our website, you can see we started in 2013, and my colleagues from way back when who are on the phone will remember this. We did not have that many responses at all. Maybe a few hundred between the two counties. It was done in a very basic way. I set it up on SurveyMonkey, and I entered every single zip code on Long Island for people to check off. And but we still got some good information, and we kept building on it and improving it and building and improving. But the questions have pretty much remained the same. So you can see this. You can see how the involvement of this and the trends and what has been of concern over time. And pretty much it's always chronic disease because, well, chronic disease is the #1 driver of healthcare costs. And that's what most people suffer from at this point in time. Even cancers, many cancers are considered chronic diseases at this stage. So, so it's been out there for quite a while. It's a good tool. We did look at it again, as I said, very extensively back in October when we met, and made some changes. One change not being adding a COVID question specifically for the reasons I stated, but made a couple of other little tweaks here and there. All right, so that's the toolkit. Avail yourselves of that. Anytime, call us. We're happy to co-brand anything, help you do anything you need to get the information out. We're here to help. What's next? Okay. I just wanted to throw this up there. This is, we've been working with the AARP Long Island chapter or regional group, whatever they call themselves, for about a year. It's taken us about a year to pull this series together. Called Talk with a Doc series. It's a Wellness Wednesday, every other Wednesday, starting in May, going through to July, where they wanted us to connect with physicians from hospitals and in the community who could talk about a specific health benefit. Very, it's just that half an hour, give people good tips, walk away with a few tips in hand that they could use. Again, it's centered on chronic disease. And these are going to culminate with 2 walks, Walk with the Docs, in 2 parks in the summertime. And I think that's on the next slide, but let's just go back to the other one for a minute. Just want to talk a little bit about this. So you can see it's diabetes, Alzheimer's and dementia, heart disease, asthma, arthritis, osteoporosis, all those wonderful things that those of us 50 plus start to experience much more so than the younger population experience. However, that does not exclude that some younger individuals also suffer from chronic diseases, because they do. This is really, particularly for the hospitals, really had nothing really that they had to do other than to find a doctor who was willing to do this. It's all virtual for about 20 minutes. It's about they talk for about 20 minutes on a very specific topic and then answer questions for another 10 minutes. And they get great exposure, right? Because ARP is sponsoring this. We're the host, but they are sponsoring this and they are promoting it every which way possible. So I'm really hopeful that this is a successful series, and so successful that ARP will want to repeat it perhaps at another time, maybe in the fall or whatever it might be. So we're real excited about that. So that's Talk with a Doc series. As you know, we have a Walk with a Doc chapter that the collaborative established in 2016 or 17. And that is allows us, we basically have to pay for the license to use the Walk with a Doc platform. They have a procedure when you hold community walks in terms of approvals and consents that you have to collect for people to walk and whatnot. And they also help promote it through their media channels. But we have that, and we've collaborated with quite a number of community-based organizations and hospitals, libraries, over the course of the past few years or so. We've really picked up on this. And again, it's another great way to engage with your community. We do circulate a pre and post survey about the benefits and the knowledge one has of walking and exercise and chronic disease. So we do collect some data, right, to measure knowledge change, knowledge gained at all of these series. But I just wanted to remind everyone that it's a great opportunity to collaborate, and it doesn't cost you anything. We do all the, right, Brooke, we do all the behind scenes planning.
Yep, all the planning, all the promotion, really just an organization needs to provide a speaker.
Yeah,
And
right.
I know some of us on the call, we are planning some initiatives together, like from CPIA, who's on the call today. So yes, many opportunities to partner on these events.
Yeah, and really what it is a physician who, like I said, that's the series, but then if there's just a walk that you want to hold in the community, maybe in your local community, it's just getting a physician willing to speak for maybe 10 minutes about a health topic, and then lead the community members on a walk, either in a park, nearby park, or even in a downtown area. And that's all that it requires. And you get a little bit of data out of it, you get some exposure, and you really don't have to do anything. Just have to give us your logo and help promote it through your own channels. And we provide you with all the promotional pieces. But these are actual walk, and we call it, we also added a safety component to the Walk with a Doc, so that we also talk about, when we do walk in downtowns, pedestrian safety, some of the laws that people don't know about to keep them safe. We point out some of the built environment improvements like crosswalks and curb cuts and timed lighting crosswalks that have been put in place to keep pedestrians safe, because you can't walk if you don't feel like it's a safe place to walk. So we added that, and some of them we add that in, some of them are just pure walk with the docs, some are walk safe with the docs. And in Lindenhurst, coming up soon, the library reached out to us because they have a walking group there, and they wanted to take them on an actual walk through the downtown and point out, include some safety tips with that. So that's happening in April, not too far away. And then again, another one in April in Wyandanch, and we're partnered with a variety of organizations, as you can see there, and the same thing in Glen Cove. So we're starting to have organizations reach out to us now, which is good. So that's just something I wanted to remind you all about.
Question, Janine, on this Walk with the Doc, you have dates already set up for the ones in Jones Beach, or these can be, like you said, in any downtown area? And what is it that's required of us? Just to give you a doc's time and lay out the route, or?
Yep, you give us a doc. The doc could be, we've had docs we've had neurologists, we've had gynecologists, we've had cardiologists, you name it. Yes, and then what is the route that you think, keep in mind,
What's the normal
it's usually like an
mileage?
hour by the time they have a few 10-minute talk, and then they do the walk and come back. You don't want to overdo it, because they're all different age groups and different abilities who are people who are going on the walk. And that's all you have to do.
Are there registration, or how
We
do
do
you
the
keep-
we do that, right, Brooke?
Yeah, all promotion, all registration, all of that we handle on our end.
Yeah,
And of course, we would share that with you for co-promotion.
yep,
Interesting.
yep. And I think those pre and post surveys that we distribute, you know, it's not an abundance of data, but it's something. And we've
How-
done,
Do they all fill them out? Is it a requirement? I mean, I don't know how many, is there a table set up for the beginning piece of it?
Brooke, you want to explain how you have this under control?
So typically at the walks, we do have a table with both paper surveys, and we'll have a sign with the QR code so people can scan it and do it on their phone. And I'll typically have that QR code with me. So even on the walk, if someone's like, hey, what about that survey? You know, we'll be able to provide them with that. So we've gotten a pretty
that's-
good response in the past.
So that's not the survey we're talking about, the big survey. You're just telling
No.
pre and
Separate
post.
survey.
Yeah,
And you come to all of these walks?
yep,
Yes.
yep. What was I just gonna say? Yes, so you asked, Carolyn, does everyone, are they, you know, do they have to fill it? Well, no, you can't force anybody to complete a survey. But let's use the term, we are respectful nudgers. We nudge people, like we'll say, oh, did you fill out the survey? And, oh, no, okay, oh, I hear, you know, here it is, or here's the code, you know, take a picture of this. So we try to get as many people as we possibly can at the event to do that. And then we have to remind them after it's over, now complete the other part of it, because we want to see, what did you learn about health? What did you learn about pedestrian safety? And we have been doing this over, I don't know, quite a number of these. And so we are amassing this catalog of responses that we will compile at some point, right? Brooke, isn't that the goal, to compile it? And although it's in different locations, right? So we're in Wyandanch, we've been in Hempstead, we've been in Lindenhurst, Babylon. We're going to be in Glen Cove. We've been in different locations, and that's noted in the survey results, right? So where the location was, but we want to compile it into some kind of a report and make that available as another data source for everyone. If you, like Carolyn, you're in the Patchogue area, so a walk in Lindenhurst or Hempstead really doesn't matter to you. So, but it does to a facility or a, you know, but it does to the health department, for instance, the Suffolk County Health Department, right? If we are in Lindenhurst or, and I think Amityville we might be in at some point, in Wyandanch, well, that's attractive to them because that's data in Suffolk County. For you, if you did something in Patchogue, that would be attractive to you. Medford, whatever your catchment area is. Yeah. So, you know, you just reach out to us. Somebody had something up here in the chat and it went away. So let me see what it was. Samantha Wood's excited for the walk on April 23rd in Wyandanch. Looking forward to seeing. And then Catholic Health will be happy to provide speakers in any specialty. St. Francis has a long-established walking club at the D. Mateus Center. We would love to participate. Wonderful. Okay, absolutely. We will follow up on that. And just want to remind you of that, because this is one activity that we were able to maintain after we lost funding and even after the pandemic hit, because it was outside. So we were able to kind of get away with this. So it's really picking up steam, and the community members are grateful. I'm not going to say you get hundreds of people at these walks. Don't think that happens. 20 people or so, maybe a little more. But if you, again, think about it in small wins, like if you reach one or two people and really get a message that resonates with them about health or walking safely or whatever it might be, compounded over time, you're making a difference. And that's how we look at it. we all know how hard this is, right? Public health, community health is hard. Okay, I think and any other questions about that? No. Okay, we could go to the next slide. So here's a little plug for us, only because I keep forgetting about this. I established, and this was because I had community-based organizations and other social support organizations often ask me for assistance in their communications, developing campaigns and social media posts, and we would do that. We've done that even in the other region up in the Hudson Valley. We had a health department that wanted us to help them out with something, and we were happy to do that. And I realized, well, maybe, you know, there's a market for this. So we turned it into this service line called Alliance Health Communications, which is really targeted for small not-for-profit social services, public health sectors, organizations that have hardly any budget, like have a shoestring budget, because we're so used to working with shoestring budgets. So we're pretty good at that now. And you know, if you want to take a look on our website and see some more information, it's extremely competitively priced. We've done work for a few organizations now, and all the way from holding, I don't know if we did any walks for anyone, but well, some of these services we've done, I don't know why I'm blanking, Brooke. We've done market, we've done like a market scan and did a comprehensive of competitors that the organization is facing and what would distinguish them from their competitors. What else have we done?
Some more
podcast placements. I'm jumping on you, sorry, go ahead.
It's okay. Some content creation, some social media management. Yeah, market research, like you were saying. Yeah, we've done a few things.
Yeah, and also we're beginning to amass on our own directories or lists to all public schools, not just the districts, but all the schools on Long Island, right? For those who are working with youth in the schools. We've been amassing lists about primary care physicians and physicians who work more in that chronic disease management space. The libraries, we certainly have a very, very good relationship with pretty much all the libraries.
These services are offered free to the nonprofit hospitals?
Well, no, not free. Not free. No,
Not free.
I mean, you know, so what I put together was, I can't do everything. Like I said, there were a number of organizations that reached out to us and we helped them out. And I realized there's a need here. So we put together very competitively based. And Carolyn, if you go on our link there and look, you will see, of course, there's years and years of experience of health communications that comes behind this. There's this policy, health policy, community health policy, public policy knowledge that comes behind this. There's the nuanced understanding of hospitals and how hospitals have to operate within the healthcare sphere, right? So there's all that too. And it's very, very competitively priced. So it's not, we absolutely undercut commercial agencies because we're good at it, I think. We know how to do it, and we know how to repurpose materials, blog posts we can repurpose. We you know, that's another thing, we do a lot of blog posts. And I have like a communications and marketing background mixed in with community health and public health. So I have this like, and Brooke has the same. So we have this very kind of unique mixture of skills that we can bring to this. And then of course, the whole base of the Long Island Health Collaborative is a variety of community-based organizations and institutions that we regularly can communicate with and help, you know, if there's an organization that needs some promotion, we can assist in that regard as well. We have that whole base that we reach out to. Any questions? I just wanted to remind everybody about it because I haven't really had a chance to talk about it because we've been busy doing work for some clients. So I'm like, well, we'd like to get some more and whatever. Okay, so what's next on here? I think we might be, yeah, we're coming down to the end. I told you this wasn't going to take the full 2 hours. And I bet you're all happy for that. So we'll meet again on June 30th and September 29th, and December 8th. And I can't believe it. That closes out this year. Oh, I don't know where the years are going, but they're going. And again, the China 2022 work group, they are meeting on Tuesday. I am going to share that link with you in case you want to pop in on that meeting. That is where we will be looking very closely at all the data results. At the Long Health Collaborative's next quarterly meeting in June, we will also, if you don't feel you have to go to the meeting on Tuesday, but at the meeting and on Thursday, we will also be looking very closely at all the results, pulling them up and kind of dissecting it and having conversations about that. So that's put that in the back of your mind as well. Anything else that we're missing, Brooke? Do you know? Missing anything?
No, not unless there are any questions, concerns.
How's everyone
Discussion.
feeling about the pandemic at this point? I know my hospital colleagues are just probably keep waiting for the end, although BA2 variant doesn't, that's coming along. Well, that is here already. I know it's been a really, as we saw, mental health issues rose to the top, and I don't think any of us have escaped the anxiety, some feelings of depression, some feelings of hopelessness that as we have gone through these past couple of years. And particularly, I want to shout out to those frontline workers, both of the health departments who are out there with vaccination clinics, to the hospitals who are out there on the front lines taking care of these individuals early on in the pandemic when we really didn't even know what we were dealing with, and the whole issues of not having enough personal protective equipment and the ventilator shortage. And it just, I cannot imagine what it was like being in a hospital working under those conditions. And I really I hold them all in such high esteem. And even those who were behind the scenes in the hospital, they were under the pressure too, and are still under the pressure. And speaking, I'm sure, from everybody on this call, we absolutely appreciate all of the efforts that have gone into helping our community stay as safe and well as it possibly could have during these 2 years, and continuing to do so. I know that the health departments did a phenomenal job with their vaccination distribution. Both the health departments, the hospitals, community-based organizations were involved, right? They were reaching out to their faith-based communities. They were reaching out to populations that were hard to reach because they were the ones who were the boots on the ground. It really, really was the ultimate illustration of collaboration in action. And I'm just really proud to be part of all of this with all my colleagues. I just want to say thank you. Anyway, fingers crossed that BA2 disappears. Don't you say no, Carolyn. Let's hope, But everyone, please stay well. We will see you in June 20 something. I forget now already. It was
30th.
June 30th. So we'll see you at the end of June. We'll be in summertime. So we'll talk to you then. And of course, we're always available. Take
Thank
care.
you.